my name's Emma. I'm a deputy team leader based in Newtown in North Powys. I've been asked just to do a little clip really just explaining the problems that we're facing as a service within district nursing because of the rise in fuel costs. So within our area we are very rural. We cover a radius of about 25 miles, might be even more actually, and we see the most vulnerable of patients within our community. So we've got the elderly and frail patients, the palliative patients and the complex patients as well. So they are priority calls and they do need nursing care within the community. So we do have a pool car that we use, and there's only one within our team. Normally that is allocated to the nurse who travels the furthest in that day. However, all the rest of us, we still have to obviously drive our own cars to see the rest of the patients. On a personal level, I'm one of the girls that travels the furthest to and from work. I travel 24 miles each way. And that doesn't take into consideration the home visits either. So that's 48 miles a day without the patient visits. So within an 8-day period last week, I filled up my car with £150 worth of diesel. And as you can imagine, that is not going to be sustainable. We obviously try and arrange our visits according to geographical areas, and we try and minimise visits as much as possible, but in some cases we can't, especially with the complex and the palliative patients. At the start of the pandemic, the fuel costs were pretty low. It was good news for us really, because a lot of people were working from home, but as our service we were still running. So it wasn't too bad then, but in the recent couple of weeks it's been absolutely horrendous. So I am unsure how many of the professionals are going to be able to carry this on really. I know speaking from a personal level, as I've already said, it's having a massive impact on my wages and my bank balance as well. So I do hope the government do take this into consideration. We do use an expenses app which we log all of our visits on. We do that every month so we can claim mileage, but it's been on the same rate for many years now, and it hasn't been altered even with whatever's going on at the minute with the increase in prices. So I hope the government do take this into consideration, and I think the expenses claims, they should be they should be related to the cost of the fuel prices really, and we should be paid what we're having to be paid at the petrol pump.